at New Hanover Regional earlier this year. Kent was riding his motorcycle in Wilmington when he was hit by a car, and his leg was crushed. He almost bled to death, but thanks to witnesses and our first responders, they were able to stop the bleeding and rush him to our trauma center. You may have seen his story of survival on the news and his recovery. Kent had such a positive attitude given the circumstances, and he was determined to recover. And after surgery and a few weeks in our rehabilitation hospital, I know he was ready to go home, but he wanted to do one more thing, and he asked for the chance to thank all of the team members involved in his care. And that's not a typical request that we get. So we assembled his care team. There were about 30 in attendance. And at that point, he proceeded to personally thank each and every one of them for saving his life and helping him with his recovery. And you could hear it in his voice. It was coming from the heart. It was very emotional. Everyone in the room was getting a little misty-eyed. And I must admit, I was fighting back a tear myself. And it was at that point I was so proud and am proud to be part of that team. And I knew that I made the right decision to join New Hanover Regional so that I could bring all of my experience and everything in my power to support our team in creating a healthier future for this community and bring remarkable experiences to our patients, just like we did with Ken. I'm approaching 3 decades in healthcare. Most of that's been in Texas. That's where I'm from originally, where I grew up, went to school. My wife Holly and I moved to North Carolina in 2014. We have 4 kids and 3 grandkids. And we've had to move around a few times for work over the years. We lived in some different places, and we both agree that we're home now. We love Wilmington. So y'all are going to be stuck with me for a while, at least until we accomplish everything on the plan I'm going to share with you in a moment. Now, I've had the privilege during my career to lead very high-performing hospitals. I was the CEO of a hospital in Austin, Texas, that was recognized as one of the top 20 hospitals in the country. I've worked at Duke University Hospital, and I've been with UNC Health for 10 years, most recently in Raleigh as the president of Rex Hospital, one of the top performing hospitals in the state. And I noticed some common characteristics among those top performing hospitals. They all had a shared vision, clear goals, and a plan to achieve those goals. Top-notch quality physicians, a talented workforce dedicated to providing the best care. They all had the support and the resources from the healthcare system they were a part of. And lastly, an experienced leadership team to bring it all together. New Hanover Regional now has all of those elements in place. In Southeast North Carolina, Novant Health cares for over 5,000 patients every day. That's over 2 million patient encounters annually. And each of those patients has a unique experience with Novant Health. And some of those experiences have been mixed the past 3 or 4 years. During that time, New Hanover Regional has experienced a lot of change and some disruption. Acquisition, global pandemic, nationwide healthcare workforce shortage, capacity constraints, integration into a new organization, and leadership changes. That's a lot. And those disruptions can impact the culture of an organization. It can create uncertainty among staff and the community. I now have a very good understanding of where New Hanover Regional has been, but even a better viewpoint of where we are today and where we are going. So where are we going? Well, the uncertainty of the past few years was again brought to my attention last month when one of our county commissioners visited the hospital, and he asked me, what's the plan? What's going on at New Hanover Regional? Where are you going? And I said, well, I'm glad you asked. Let me show you. we have created and developed a vision for the future of healthcare in this community and a roadmap to get there that was recently endorsed by our physician leadership and our governing board. And through Novant Health, we have the capital and the resources that will allow us to execute this plan and accomplish these goals. And this is the strategic framework. Within these 5 pillars, all of our objectives, goals, initiatives, efforts will fall into one of these categories. And starting at the left is really our workforce, recruitment, retention, engaging and empowering our teams to help us accomplish all the goals set forth, to ensure that we're providing the highest quality care and the best outcomes, and that we're providing our patients and their families with a great experience when we do so. Focused on operational excellence, and then growing with the growth in the region, creating more access. And now I'm going to share with you the overarching goal for each one of these categories. But before I do, just a point of clarification. All of these goals that I'm going to share with you will be accomplished by 2030, not in 2030. I got questioned about that from the board, and I had to clarify. They said, you have to do this faster than 2030. Yes, some will be accomplished in the next 1 to 2 years, others 3 to 4 years, but everything by 2030. We will be recognized as the employer of choice in the region. I would be surprised if there's anyone in this room that didn't have a family member, a friend, a neighbor that worked at Novant Health. We're the largest employer in the region, and our staff deserve the best place to work. Our physicians, our nurses, our staff, they're proud of their profession, they're proud of the work they do, and they're telling us what they need to be their best and to do their best work. And we're listening and we're responding. And as we continue to address workforce needs, I really appreciate our partnership and relationship with Cape Fear Community College and UNCW, and I appreciate their commitment to educating the future healthcare workforce that we need in the community. I also want to thank the Wilmington Chamber and the Health Talent Alliance for their work to help create that pipeline that we need in our medical community. New Hanover Regional is a teaching hospital, and as a branch campus of the UNC School of Medicine, we're educating more medical students, many of whom will stay locally to do their residency. And we're expanding our residency programs and the number of resident slots so that we can grow our own pipeline of doctors we need in the region. When compared to other hospitals across the country, we will perform in the top quartile or decile of all publicly reported quality and safety indicators. Now, we've been taking some heat in the news recently for our Leapfrog safety grade and our CMS star rating. And for those of you that are unaware, CMS, the Center for Medicare and Medicaid Services, and the Leapfrog group rate hospitals based upon quality, safety, service, and efficiency. And I think that those ratings are very good indicators for consumers, for patients, to understand a hospital's performance 2 to 5 years ago. CMS uses a data set that goes back to 2019, with most of the performance period being in 20, 21, and 22. And the Leapfrog group uses a performance period that's 21, 22, and the first quarter of 23. I'm not making excuses for that performance or those ratings or trying to defend them. We weren't at our best during that time period. But I can assure you that our current performance, those scores do not reflect our current performance or the care our patients are being provided today. In the summer of 2023, before my arrival, our physicians and our staff renewed their focus and efforts to improve quality and safety. Folks, we have nationally recognized centers of excellence in this community: heart care, stroke care, orthopedics, and maternity care, just to name a few. And the care being provided is as good as or better than any in the state. New Hanover Regional once was and will be again among the best performing hospitals in the state in terms of quality and safety. We will be top quartile or decile for patient experience. Our patient satisfaction scores are trending up. They have been for the past 2 years. but relative to other hospitals, they're only average. There's room to improve. One of the biggest patient dissatisfiers has been our emergency department. And I can tell you that a visit to our emergency department on our main campus today is very different than what it was 2 years ago. Our wait times have decreased dramatically. And I would not hesitate to send my mom, who I love very much, to the emergency room at 17th Street if she had an emergent condition. If it was life-threatening, I know she would be seen and cared for immediately. And if it wasn't, she may have to wait, on average, 10 or 15 minutes to get back to her room, another 10 or 15 minutes to see a physician. Then I would tell her if she needed to be admitted to the hospital, there could be an extended wait in the emergency department. Our hospital stays full. We don't have an emergency department problem. We have a inpatient bed capacity issue. We don't have enough beds. The good news is we have a lot of work to build more capacity. I'm going to share that with you in a moment. We will be best in class in performance in terms of throughput, access, efficiency, and innovation. The work in this category is designed to support and enhance our physician experience, our team member experience. This can get into the weeds. I want to move on in the interest of time to get to some of the growth projects. We will increase access to care to meet the demand in the community. The population growth, the aging population, and the area that we serve continue to grow and expand. We're the regional referral center for the surrounding 12 counties. And at any given day, 25% of the patients in our hospital are from beyond Pender, Brunswick, or New Hanover counties. And as we continue to address the region's growth, we will create more access to our physicians and to our hospitals. Since 2021, we've invested over $600 million in capacity building projects. And a lot of that investment is related to our campus up at Scotts Hill. The bottom right is an artist rendition of that hospital that's being built under construction, slated to open in 2026. And if you go to the campus, if you've been up there, this campus is really taking shape, and the structure's there. It looks pretty phenomenal. We're recruiting over 70 physicians and advanced practice providers every year for the foreseeable future. And we'll open 3 new medical office buildings over the next 18 months to accommodate those providers. And we have $1 billion in proposed capital investment currently under review that I will take to our governing board in the spring for their consideration and approval. Among them is the modernization of our Heart and Vascular Institute and a new 120-bed patient tower on our main campus. And I look forward to sharing more details about this project when our board approves it next spring. Barb, you're going to approve it? So, just like Kent approached his recovery with a very positive outlook, a determination to get better, and a commitment to taking his recovery one step at a time, New Hanover Regional has a positive outlook. We're determined to get better, and we have a commitment to improve and create a remarkable experience, one patient at a time. New Hanover Regional is your hospital, and as the only hospital in town, my team and I have a tremendous responsibility to you and this community to do better, to be the best. And I'm confident that we'll be able to do that, and we will accomplish that. I'll see to it. Thank you.